Dr. Mark DuPéré, board-certified plastic surgeon. Breast surgery overall is likely the most performed procedure in the aesthetic world worldwide. Of all those surgeries, breast augmentation with implant is by far the #1 procedure. Breast surgery was also the focus of my fellowship when I traveled to Paris, France in 2002. This is where I learned many of the European finesse in breast surgery, which relate to both breast augmentation procedure and breast lifting procedures. Breast surgery is a #1 procedure at the Visage Clinic, along with liposuction, body sculpting, and facelifting procedures. When somebody chooses to undergo a breast augmentation procedure, I do like to meet 2 or 3 times with that person so that we can go over all the options available for my patient. Many things are important to discuss, and one of them is the type of implant we're going to choose, the location of the implant itself, the location of the incision, along with the recovery that needs to be discussed in depth with the patient. So in Canada, we have several types of implants available for our ladies. We have the saline implants, which are the water-filled saline implants, which have been around for many years. And we have the newer 5th generation of silicone cohesive gel implants. The 5th generation implants are very safe. They've been in Canada since about 2002, 2003. They come in various shapes and forms, most commonly the round and the anatomical so-called teardrop shape. The implants come either smooth surface or textured. So I have 3 examples of breast implants here to show you. First of all, we have a cohesive gel, silicone gel implant of the round shape, smooth surface. Here I have a round implant, again, cohesive silicone gel of a textured surface. And finally, I have an anatomical so-called teardrop shape implant, textured, also silicone gel. So when I meet with my patient, one of the key points to discuss is the location of the incision. The incision is commonly performed under the breast, just above the fold. The incision is approximately 4 to 5 centimeters in length, depending on the size of the chosen implant. Another option for the incision is around the areola. The areola being the flat brown disc around the nipple. The incision is commonly located at the margin between the brown and the beige of the skin, between 4 and 7 o'clock. The third location for the incision would be in the underarm area, within the hair-bearing part. This incision is reserved for a particular group of patients where we have a known history of bad scars. The pros and cons for each incision is discussed with the patient, and the decision is taken together. Another important consideration, which I discuss with my patient, is where the implant will be positioned. The various options include under the pectoralis muscle, which we commonly refer as a subpectoral or submuscular plane. A second location is under the gland, so we call it a subglandular plane. And a newer version is what we call a subfascial plane. The fascia is a thick, strong layer above the muscle. It is helpful to put the implant behind that piece of fascia to keep it from moving down with gravity. It also avoids some distortion of the implant when an implant is put under the pectoralis muscle. Now, there are cases where we do put the implants behind the muscle, and in those situations, I do perform the dual plane technique. So breast augmentation is also commonly performed after pregnancy and breastfeeding. It is very common with pregnancy and breastfeeding that the breast will come down with gravity. So that sagginess in the breast, which we refer to as ptosis, can be corrected with a breast lifting procedure called a mastopexy. A mastopexy can be performed alone as a solo procedure, or can be commonly added to a breast augmentation as a combination procedure. There are 4 main types of techniques for mastopexy or breast lift. The simplest one is to remove a crescent of skin above the areola and to do a small lift superiorly. The second technique is a periareolar donut-like technique where a rim of extra skin and areolar tissue are excised and a crescentic circular closure is performed, and the resulting scar is around the areola. The third technique is the most common technique used in mastopexy procedure, is the vertical periareolar mastopexy technique, where the scar will look like a lollipop. So in the United States, it's very commonly referred as the lollipop technique. If you are in Canada, we often refer to this technique or the incision pattern as the Le Jour technique. Finally, the fourth technique of mastopexy is the older technique of the anchor style incision, where you have an incision around the areola, a vertical incision, and an incision along the inframammary fold. In all my mastopexy procedure, I find it crucial to perform a glandular remodeling technique along with glandular suspension, and the suspension can occur at the rib level and at the fascial layer. This will assure a longevity in the mastopexy results. Another concern that is commonly voiced in my office is the one of a large areola. Areolas do enlarge with pregnancies and with breastfeeding. So it is very common that ladies will ask the plastic surgeon to reduce the areola, and it was studied in the past that a sexy, youthful areola was approximately 4 to 4.2 centimeters in diameter. So areola can be reduced to that diameter for a youthful look. Areolar reduction can be performed under local anesthesia easily. That being said, an areolar reduction is commonly performed with most mastopexy procedure. Another request is nipple reduction. Nipples can be large or can be asymmetrical, and it is commonly performed under local anesthesia in order to achieve symmetry. An inverted nipple is also a common issue in some of my patients. Correction of inverted nipple is a simple procedure done under local anesthesia. The idea is to release the tight breast ducts that have developed during adolescence or after pregnancies. A last common issue that we get at the clinic is what we call a tubular breast. A tubular breast is a developmental anomaly of the breast which can occur on one side or both sides, where the breast will look tubular in nature. A tubular breast deformity is a complex deformity which requires many different techniques in breast surgery. Notably, we will use a combination of breast implants, release of tissue, and a reduction in the areola. So in summary, breast surgery is complex but fascinating. So it is very important for you to choose a plastic surgeon who has a strong interest in breast surgery and who is board certified.